and welcome back to Question Corner with Dr. Tara Kaur. This is episode 2, and today we're just going to start talking about how to become a new patient with our office, what that new patient appointment entails. So I'll turn it over to you.
Well, thank you, Carly. This is a great question. We get this question multiple times a day, and I think it's important to answer because what we do in our new patient comprehensive evaluation appointment is different than what you're going to find in most conventional dental offices. Our philosophy is really based on empowerment with education and individualized care. And so in order to put a holistic wrapping around all of that, it takes a little bit of time for us to get to know you and for us to evaluate what's going on, not just in the mouth, but also what's going on in the body as well. So the appointment is longer. It is a 90-minute appointment, and before you even come in the door, there's some paperwork that needs to be filled out. And it can feel a little overwhelming. We've consolidated it down quite a bit, but the reason why we have all of the questions and all the different forms is because we want to be really upfront with all of our different policies and all the different options that we have here in our office. Then we also want a comprehensive medical and dental history so that we can really look at the whole picture before we come in and greet you in the treatment room. So it starts with paperwork. The nice thing is that we have a beautiful website that's very easy to navigate, and all of this can pretty much be done online beforehand if you have that capability. Otherwise, you certainly can print things off and drop them off or mail them in to us. But once the paperwork is complete, then myself and Bonnie, our hygienist here, will really go through all of that and look at that, as well as Mary, my assistant, and we'll put together a picture of your health and wellness and what your concerns are. And then as you come into the office, we're prepared. So we already know what you've been through, what your main concerns are, what your questions are, and we can make sure that we have enough time to address all of that. So the nitty-gritty of the appointment entails gathering a lot of information. And so we start with a comprehensive conversation about your medical and dental history. And once we get that information communicated, then we start looking inside the mouth and we start taking a peek at what's going on. So the appointment would include a full oral exam. So we do some intraoral charting, which just means we make a map of your mouth on the computer. We're going to identify any areas of concern from a functional standpoint, so if there are cracks or fractures in the teeth, if there's tooth decay or cavities, if there's periodontal disease, if there's any pain or sensitivity that you're experiencing, things like that will be identified. Once that information is gathered, then we also do photos of the mouth, so we take some comprehensive photos of the mouth. We also take x-rays if it's appropriate. We probably will use x-rays as a whole topic for another conversation, but we individualize our x-ray protocol here. So that does not mean that everyone that walks in our door gets a full mouth set of x-rays. We really try to use what you've had taken at your previous dental offices, and then really look at what would be appropriate for diagnosis and treatment for each individual. So we really do individualize that part of our care. So the x-rays, the photos, the intraoral exam, and then we also do, if you have any sort of dental metal in your mouth, we do what are called electrical readings. And this is a specialized piece of equipment that we use to measure the capacity or the ability of a metal restoration to store electrical charge. And this can be very helpful in allowing us to determine if we're doing a dental revision, which again we'll talk about, but that's basically removing the dental metals from the mouth. The information with the electrical readings can be a very important part of figuring out how we're going to do that. So all of that is basically the inside your mouth part of it. Oftentimes Bonnie, our hygienist, will come in and she'll do a full periodontal assessment. This lets us look at the health of the underlying bone, of the gum tissue. We also evaluate your joint, we evaluate your occlusion or how your teeth come together. So we're really looking at a lot of different elements in this appointment. But I would say the majority of the time that we do take is with empowerment through education. And so that's a team effort here in our practice. So you're going to be experiencing information and learning with Mary, my assistant, with Bonnie, the hygienist, with Carly, because Carly, you do all of our consulting with well, you help with the treatment planning and the scheduling, but you also do most of our dental materials, testing, consultations, and helping patients out with that. And again, that's a whole other topic. So, and then for me, of course, it's going to be, what does a dental revision involve? What are my options for dental treatment? How do we, look at approaching, my health and wellness as naturally and holistically as possible. So a big part of that is a consultation with me, and we discuss all sorts of different things which are going to come up in our video blogs here, with root canals and dental amalgam and dental metal restorations and bruxism or grinding the teeth, TMJ problems, all sorts of different things, periodontal disease, and really looking at how we can give you the information that you need in order to make an informed decision. So that was a really long, rambly answer, sorry. But it is a lot. We do a lot in that 90 minutes. And you don't get your teeth cleaned. And the reason why we don't schedule a cleaning right away is because we need to gather all of that information to determine, first of all, what type of cleaning do you need? Secondly, do we need to do some education before you come in for your cleaning, so we can make sure that you can make an informed decision about what is going to be the best way for you to move forward. So we do talk about all of that, and sometimes you just need a basic cleaning, and sometimes it's much more involved than that. So, so the first appointment does not include a dental cleaning in any way.
Well, that's a great summary. I mean, very in-depth, lots of questions answered. If you have any other questions, you can always give us a call, 952-956-6700, and I'd be happy to answer any other questions that you have. Please don't forget to email us if you have any other topics that you'd like us to discuss. That's smile@tarakardds.com. Thanks so much for tuning in, and we'll see you next time.
Bye.